Canada faces a persistent public health challenge. Despite being a high-income country with universal healthcare, it continues to experience high mortality from non-communicable diseases, especially cardiovascular disease, the leading cause of death nationwide. Reducing cardiovascular disease is important because it would prevent thousands of avoidable deaths, lower long-term healthcare costs, encourage more doctors, and increase government spending on public health. Our target audience is Health Canada and the Public Health Agency of Canada, or PHAC, specifically the federal policy analysts who work in these agencies. They're responsible for tracking chronic disease trends and developing strategies to reduce preventable deaths, which means they need to understand why Canada falls behind other countries and which factors the country can realistically improve. Although global health datasets exist, they are fragmented, inconsistent across sources, and difficult to compare. Existing analysis tools are separated, and none connect outcomes to policy-relevant upstream factors, making them impractical to compare Canada against better-performing countries and identify areas that can be improved. This is a problem specifically for federal policy analysts at Health Canada and PHAC who monitor national health outcomes and design strategies to reduce preventable mortality. To make effective decisions, they must understand why Canada underperforms relative to other countries and which modifiable factors Canada could realistically improve. Our project fills this gap by providing an integrated, policy-oriented dashboard centered on this question. What can Canada learn from better-performing countries such as Belgium to reduce mortality from its most prevalent non-communicable disease? And which modifiable factors can Canada improve? Our integrated Tableau dashboard centralizes non-communicable disease trends, world benchmarks, and policy-relevant structural factors together into a single, accessible, and interactive tool, which clearly provides insights to control this disease. When you first open up the link to our visual, it will be something like this. Before you click on anything, you should scroll down and click on this full screen button to get the full view of our visual. This first link up here brings you to our first dashboard. This first dashboard gives an overview of non-communicable diseases. The map here on the left shows non-communicable disease death rates across different countries. If you want the exact percentages, you can hover or click on any of these countries. It will also highlight the country for you when you click on them. If you want to adjust the year, you can move this slider down on the bottom. The two bar charts on the right show the top 10 highest non-communicable disease death rates in both the world and in Canada, the top one being the world and the bottom one being for Canada. As you can see very evidently, cardiovascular diseases are the leading cause of death for non-communicable diseases in both the world and in Canada. If you want the exact percentages, you can either look at this number to the right of the bar, or you can just hover over the bar for either of these. To get to our next dashboard, there are two options. You can either go click on this back button, which brings you back to our home page, or on the top, there are three buttons here. This is the first dashboard, this is the second dashboard, and this is the third one. To get to our second one, you click on this button here. This second one goes more in depth about Canada versus the most effective country in controlling cardiovascular diseases. This first facet line plot here shows the top 5 most effective countries in controlling cardiovascular diseases, and they are ranked from best to worst from top to bottom. The top shows the best one, and in this case, it is Belgium. If you want to highlight Belgium, you can click on this button here. It will also do the highlighting for this chloropleth map down here. This bottom chloropleth map shows the countries that have lower cardiovascular disease death rates relative to Canada. If you want to adjust the year, you can use this slider over here. The two line plots here on the right show deaths caused by cardiovascular disease in Canada versus Belgium, Canada being in red and Belgium being in yellow. The difference between these two is that this top line plot here shows the exact counts, and the bottom one here shows the relative reduction compared to a baseline year. You can adjust this baseline year using this filter, which adjusts the time period. You can also adjust the time period for this top one. If you want to see the exact percentage for a certain year, you can either hover or click on one of these years. Our last dashboard goes into some potential factors, and you can access it by clicking this button. Our third dashboard shows us 3 potential factors that could cause Canada to have a higher death rate. You can adjust the potential factor by using this filter to the right over here and clicking on the one you want. Once again, if you want the exact percentage, you can always hover over any of the points on the line. Once again, the deaths caused by cardiovascular disease is then showed on the bottom, as you can use it as a comparison to show if there are any trends between the deaths and any of these 3 factors. Overall, this workflow turns scattered and hard to compare data into one clear and usable system. For policy analysis, the tool reduces the time needed to synthesize complex datasets and enables faster, more targeted analysis. For the broader population, better informed policy decisions could contribute to fewer preventable deaths, lower healthcare costs, and improve long-term public health outcomes. In the end, this supports faster, more targeted, and better informed decisions for reducing cardiovascular disease. For our scientific process, we followed a structured process built around the needs of our target audience. We began by defining our core question: how Canada's non-communicable disease burden compares globally, and what lessons Canada can learn from stronger countries. To build this foundation, we used WHO and global burden of disease sources because they provided consistent definitions across countries. We focused on mortality share and age-standardized death rates to enable fair international comparisons, while also incorporating death counts to show the overall burden. Using rates was essential for comparing countries with different population sizes and age structures, and using counts provided important context about the scale of mortality within each country. For our dataset, we selected the IHME Global Burden of Disease estimates because they provide standardized, peer-reviewed mortality measures for all countries from 1980 onwards. Using these measures, we identified the top 10 global non-communicable disease causes and repeated the analysis for Canada. Cardiovascular disease emerged as the leading cause worldwide and domestically, giving us a strong evidence-based reason to enter the dashboard on cardiovascular disease mortality. We designed our visual choices around how Health Canada and PHAC analysts actually use information. Line charts show long-term trends clearly, which is essential for policy tracking, while bar charts became too cluttered, and stacked area graphs risked implying relationships that weren't meaningful. We included the choropleth map because it offers an intuitive sense of global variation. Alternatives like scatter plots or ranked tables didn't convey spatial patterns as effectively. Hover interactions were added to give analysts precise values without adding clutter. The facet line plot on the top performing countries then allowed us to compare long-term cardiovascular mortality trends side by side, making it clear that Belgium consistently achieves the lowest rates and is therefore the most appropriate benchmark for deeper comparison. Selecting upstream factors required careful judgment. We focused on indicators that are structural, modifiable, and comparable across countries: doctor per 1,000 people, the daily cost of a healthy diet, and health spending share. These reflect system-level conditions that governments can influence. We intentionally excluded behavioral or clinical variables such as smoking, alcohol use, obesity, and hypertension. These require more complex modeling and vary widely across demographic groups, and include too many attributes would dilute the dashboard's clarity. We also evaluated analytical alternatives. Correlation lines or regression overlays could imply causal relationships that cannot be established from observational data and would shift the project towards causal inference rather than descriptive exploration. Our goal was to build a tool that helps analysts interpret patterns, not claim causal explanations. Finally, we addressed limitations openly. National averages hide regional differences, cultural and behavioral factors are not included, and the dashboard is descriptive rather than causal. Even with these limits, it provides a clear ground starting point for understanding how Canada compares with stronger performers and where meaningful improvement is possible.